What is the best treatment for dementia? The two most commonly prescribed medicines for dementia are cholinesterase inhibitors and memantine. Doctors use them mainly to treat the symptoms of Alzheimer's disease, which is the most common kind of dementia. They prescribe them for other kinds of dementia as well. Can a person recover from dementia? Treatment of dementia depends on its cause. In the case of most progressive dementias, including Alzheimer's disease, there is no cure and no treatment that slows or stops its progression. But there are drug treatments that may temporarily improve symptoms. What is the #1 food that fights dementia? 10 foods that can help fight dementia. Raw leafy greens. Darker greens, such as spinach, kale and romaine, have more brain-boosting antioxidants and vitamin K. Cruciferous vegetables. Blueberries, beans, nuts, fish, whole grains, poultry. What triggers dementia? Dementia causes but, as well as progressive brain cell death, like that seen in Alzheimer's disease. Dementia can be caused by a head injury, a stroke, or a brain tumor, among other causes. This prevents normal blood flow, depriving brain cells of oxygen. What foods are bad for dementia? The Western diet appears to increase one's risk of Alzheimer's, especially the consumption of sweets, meat, and high-fat dairy. In comparison, it appears that grain, fruits, vegetables, legumes, fish, and low-fat dairy products reduce one's risk. Can dementia get worse suddenly? Symptoms specific to vascular dementia. Vascular dementia is the second most common cause of dementia, after Alzheimer's. Symptoms can sometimes develop suddenly and quickly get worse, but they can also develop gradually over many months or years. Do patients with dementia know they have it? Everyone with dementia is different. If the person you know has not been ill for very long, they may be able to tell you what dementia feels like for them. A person who has had dementia for longer may not be able to tell you how they feel. But you can learn to recognize when they are feeling happy, safe and calm. Does sugar make dementia worse? Eating sugar and refined carbs can cause pre-dementia and dementia. But cutting out the sugar and refined carbs and adding lots of fat can prevent, and even reverse, pre-dementia and early dementia. More recent studies show people with diabetes have a 4-fold risk for developing Alzheimer's. Is coffee good for dementia? Studies show that caffeine and coffee can delay the onset of Alzheimer's, even in seniors who already have some form of mild dementia. Research shows that caffeine blocks inflammation in the brain, specifically adenosine receptors, which can start a chain reaction that begins the mind's cognitive decline. What is the life expectancy of someone with dementia? Generally speaking, the life expectancy of a person with dementia depends on the type of dementia they are diagnosed with, their age and health. Most studies seem to show that the average number of years someone will live with dementia after being diagnosed is around 10 years. How quickly does dementia progress? It's usually a slowly progressing disease. The average person lives 4 to 8 years after receiving the diagnosis. Some people may live as many as 20 years after their diagnosis. Alzheimer's occurs due to physical changes in the brain, including a buildup of certain proteins and nerve damage. Which is worse, dementia or Alzheimer's? Dementia is an overall term used to describe symptoms that impact memory, performance of daily activities, and communication abilities. Alzheimer's disease gets worse with time and affects memory, language, and thought. While younger people can develop dementia or Alzheimer's disease, your risk increases as you age. What are good activities for dementia patients? Suggested stimulating activities for Alzheimer's: bake or cook simple recipes together, clean around the house. Do arts and crafts, such as knitting and painting. Look at books the person used to enjoy, organize household or office items, particularly if the person used to take pleasure in organizational tasks. Why are dementia patients so mean? People with dementia might say hurtful things when you're caring for an older adult with Alzheimer's disease or dementia. They might make mean comments, use hurtful words, or accuse you of terrible but untrue things. Your older adult isn't purposely saying these things to hurt you. Should you argue with someone with dementia? Even if they don't understand their error, correcting them may embarrass or be otherwise unpleasant for them. Don't argue with the person. It's never a good idea to argue with a person who has dementia. First of all, you can't win. And second, it will probably upset them or even make them angry. Does dementia run in families? Many people affected by dementia are concerned that they may inherit or pass on dementia. The majority of dementia is not inherited by children and grandchildren. In rarer types of dementia there may be a strong genetic link, but these are only a tiny proportion of overall cases of dementia. How do dementia patients die? The actual death of a person with dementia may be caused by another condition. They are likely to be frail towards the end. Their ability to cope with infection and other physical problems will be impaired due to the progress of dementia. In many cases, death may be hastened by an acute illness such as pneumonia. What medications make dementia worse? Medications. Some drugs make dementia worse. Benadryl, found in cough syrups and over-the-counter allergy and sleeping pills such as Tylenol PM. Bladder pills such as tolterodine, Detrol, oxybutynin, Ditropan. Trospium, Sanctora, do help when patients need to urinate often. How can you reverse dementia naturally? From that perspective, these 8 strategies help many of my patients reverse or prevent dementia. Balance your blood sugar with a whole foods, low glycemic diet. Eat healthy fats that make your brain happy. Exercise daily. Supplement wisely. Check your thyroid and sex hormone levels. Is cheese bad for dementia? Foods that induce memory loss: white breads, pasta, processed meats and cheeses, all of these have been linked to Alzheimer's disease. Processed cheeses, including American cheese, mozzarella sticks, Cheese Whiz and Laughing Cow. These foods build up proteins in the body that have been associated with Alzheimer's. What causes dementia to progress quickly? Creutzfeldt-Jakob disease causes a type of dementia that gets worse unusually fast. More common causes of dementia, such as Alzheimer's, Lewy body dementia and frontotemporal dementia, typically progress more slowly. Through a process scientists don't yet understand, misfolded prion protein destroys brain cells. What is end-stage dementia? Dementia is a progressive brain disease. A person with dementia will follow a fairly typical pattern of decline, although the pace at which this occurs will vary. Eventually, your loved one will reach the late stage of dementia, also called end-stage dementia or advanced dementia, in which symptoms become severe. What is the last stage of dementia? Sometimes called late-stage dementia, end-stage dementia is the stage in which dementia symptoms become severe to the point where a patient requires help with everyday activities. The person may also have symptoms that indicate that they are near the end of life. Does dementia affect walking? Dementia inhibits the ability to walk. Dementia can affect areas of the brain that are responsible for movement and balance. Many individuals affected by Alzheimer's and other types of dementia gradually lose the ability to walk and perform everyday tasks. What stage of dementia does sundowning start? It is thought that sundowning can be a problem for as many as 66% of people with Alzheimer's disease or other dementias. It can occur at any stage of the disease, but it tends to peak in the middle stages of dementia and lessens as the disease progresses. How does a person with dementia feel? A person with dementia feels confused more and more often. When they can't make sense of the world or get something wrong, they may feel frustrated and angry with themselves. People with dementia can still feel nice feelings, too. They can feel happy, safe and calm. Is anger a sign of dementia? Agitation and mood swings. It's common for someone suffering from AD to seem anxious or agitated. In addition to agitation, rapid and seemingly unprovoked mood swings are another sign of dementia, going from calm to tearful to angry for no apparent reason. Why do dementia patients crave sweets? Appetite changes as a result of dementia. Often people with dementia don't taste food and experience flavor like they once did, which can change appetite preferences. Because taste buds are diminished as people age, people with dementia opt for heavy foods or foods with a lot of flavor, like sugary sweets. How do you entertain someone with dementia? Suggested stimulating activities for Alzheimer's. Bake or cook simple recipes together, clean around the house. Do arts and crafts, such as knitting and painting. Look at books the person used to enjoy. Organize household or office items, particularly if the person used to take pleasure in organizational tasks. Do people with dementia sleep a lot? It is quite common for a person with dementia, especially in the later stages, to spend a lot of their time sleeping, both during the day and night. This can make the person sleep more during the day as their symptoms become more severe. Does dementia show up on a brain scan? A brain scan, using either computed tomography (CT) or magnetic resonance imaging (MRI), is generally included in the standard evaluation for Alzheimer's disease and other forms of dementia. These scans can also show the loss of brain mass associated with Alzheimer's disease and other dementias.